morning, Dr. Osborne here with Gluten-Free Society. Today I want to talk a little bit about how gluten can impact the thyroid gland and contribute to autoimmune thyroid disease. It's very, very well researched in the medical literature, but very few endocrinologists and very few family practice doctors who are investigating thyroid disease actually make the correlation, so I want to make it for you. Gluten sensitivity in and of itself can contribute to a process known as intestinal permeability or leaky gut. Once this leaky gut sets in, we can cause a process known as molecular mimicry, which leads to autoimmune disease. So what happens is the gut opens up, it becomes more permeable, and food proteins, bacterial proteins, things that don't belong in the bloodstream start to leak into the bloodstream because the gut barrier is open or permeable. Once this begins, the immune system can start attacking these proteins, and many of these proteins mimic the thyroid hormone, and mimic other organ tissues in the body, and this is one of the triggers for autoimmune disease. That's what's called molecular mimicry. Over time, the immune system is attacking these proteins as they leak through into the bloodstream, and many of these proteins, again, they mimic the internal hormones, the internal tissues of the body, and so we start attacking our own tissues as well. That's one component of how gluten can contribute to autoimmune thyroid disease. But some of the other components have to do with malnutrition. We all know that gluten causes intestinal inflammation and can lead to vitamin and mineral deficiency. And so one of the problems we see is selenium deficiency. Selenium is crucial for activating thyroid hormone. Without proper quantities of selenium in the body, we can't convert T4, which is our inactive thyroid hormone, into T3. And this leaves us with lots of T4 but no T3, and so no thyroid activation and a slower metabolism and a reduced thyroid function. So it's very important to test selenium levels in patients with thyroid disease to ensure that this is not part of the reason why they have that thyroid condition. Iodine deficiency is another common deficiency caused as a result of malabsorption of nutrients. And iodine is crucial and critical for your body's ability to even be able to produce thyroid hormone in the first place. That T4 is indicative. The 4 is referring to how many molecules of iodine are actually in that protein or in that hormone. So if we're low in iodine, we're going to have a harder time producing T4 on our own. Vitamin A and vitamin D deficiency are two other nutrients necessary for appropriate thyroid function. Without these nutrients, your thyroid hormone can't communicate with your DNA about how to rev up your metabolism and increase your energy. We also have magnesium deficiency being associated with thyroid disease. Magnesium deficiency will lead to an inability to produce adequately thyroid stimulating hormone, or also known as TSH, if you've had these blood tests done. And so we want to also make sure that we're measuring magnesium to ensure that nutrition is not playing the bulk of the role in why the thyroid is broken in the first place. Because giving a medication like Synthroid or Levoxy, those things, although can be helpful, don't actually solve the origin of why the thyroid is broken in the first place. So it's always important to go back to fundamentals and investigate, what is the thyroid made out of? Does the body have adequate tools to produce its own thyroid hormone? And is there an autoimmune process being induced that's contributing to a breakdown or an immune attack on our thyroid hormone or on our thyroid gland? So I hope this video